Because the patient is at risk for poor nutrition and low appetite, several interventions can be used, such as offer small, frequent feedings, weigh daily to track progress, encourage to avoid fatty foods, monitor for skin breakdown, and offer good skin care cleaning. Use safety precautions with neurological symptoms or loss of vision. Orient the patient as needed for confusion. Provide emotional, cultural, and spiritual support for the grieving client who is losing all relationships and skills. Provide emotional support for significant others, family, family of choice, partners, and friends. In regards to oral care, it is important as good oral care can help to enhance the appetite. Fruits and vegetables to aid in nutrition are helpful as well to boost the immune system. Drug therapy uses licensed antiviral drugs as these have an excellent activity against HIV. However, it is important to remember that antiviral therapy only inhibits viral replication and does not kill the virus. Treatment with only one antiviral agent promotes drug resistance and does not improve lifespan. Instead, multiple drugs from different classes are used in combinations. This approach, termed combination antiviral therapy, has reduced viral load, improves CD4 T cell counts, and slows disease progression. Tell patients that they must take the drug correctly 90% of the time, making sure that out of 10 doses, 9 are taken on time and correctly. Page 351 in your book talks about prevention of infection through patient education. Some key takeaways of education include avoid crowds and other large gatherings of people who might be ill. Do not share personal toilet articles such as toothbrushes, toothpaste, washcloths, or deodorant sticks. When bathing, use an antimicrobial soap. Clean your toothbrush at least weekly by running it through the dishwasher or rinsing it in laundry bleach and then rinsing out the bleach with hot water. Wash your hands thoroughly with antimicrobial soap. Avoid eating salads, raw fruits and vegetables, and undercooked meat. Also avoid fish and eggs and spicy spices such as pepper and paprika. Additional interventions include respiratory support and maintenance, promoting rest and comfort, maintaining skin integrity as chronic diarrhea puts them at risk for skin breakdown. Priority patient problems for AIDS include potential for infection, inadequate oxygenation, pain, inadequate nutrition, diarrhea, reduced skin integrity, confusion, reduced self-esteem, potential loss of social contact. Immunoglobulin A deficiency is the most common immune deficiency in adults. Page 298 in your book, Table 17.3, Antibody Classification, lists the different functions of the antibodies and any type of deficiency symptoms that they may present with. Hypersensitivity or allergy is overactive immunity with inflammation occurring in response to the presence of an antigen, a foreign protein or allergen, to which the patient usually has been previously exposed. It can cause problems that can be mild, such as itchy, watery eyes, all the way to life-threatening, as in an anaphylactic response. The terms hypersensitivity and allergy are used interchangeably. Hypersensitivity reactions are classified into 4 basic types determined by differences in timing, pathophysiology, and symptoms. Each type may occur alone or along with one or more of other types. Teach patients to avoid direct or close contact with specific allergens identified. Furthermore, teach patients that airborne allergens can be reduced by air conditioning and air cleaning units. Removing cloth drapes, upholstered furniture, and carpeting also reduces airborne allergens. Drug therapy for symptom relief can be effective in reducing the allergic response and making the patient more comfortable. Drugs commonly include decongestants and intranasal steroid sprays. Antihistamines, leukotriene inhibitors, and mast cell stabilizers block or reduce the amount of chemical mediators in nasal and sinus tissues and prevent local edema and itching. Decongestants constrict blood vessels and decrease edema. Analgesics may be given for pain. Immunotherapy, also known as desensitization therapy or allergy shots, involves subcutaneous injections of a very dilute solution of the identified allergen. The allergy testing by skin testing or intradermal testing must be performed first to correctly identify the allergens. It is important to know that when allergy testing is conducted, nursing staff must stay with the client to make sure no acute reaction occurs. It is important to educate your patient that before their desensitization therapy or allergy shot, teach them to not take their regular allergy meds such as Claritin or Benadryl prior to the allergy testing, as this would suppress test results. Type 1 or rapid hypersensitivity, also called atopic allergy, is the most common type of hypersensitivity from overactive immunity. It is the result of increased production of the immunoglobulin E, IgE, antibody class. Examples of type 1 reactions include angioedema, anaphylaxis, and allergic asthma. It can also include atopic allergies such as hay fever and allergic rhinosinusitis, and allergies to substances such as latex, bee venom, peanuts, iodine, shellfish, drugs, and many other allergens. It can be contacted by several ways. It can be inhaled, ingested, injected, or skin contact. These can cause a variety of symptoms, and it can be as mild as watery eyes and nose, causing symptoms of rhinorrhea, sneezing, and itchy red watery eyes. And it can be also more severe, that includes dilation of blood vessels and bronchial smooth muscle, causing widespread vasodilation, decreased cardiac output, and bronchoconstriction, which is called anaphylaxis. Angioedema is a severe type 1 hypersensitivity reaction that involves the blood vessels and all layers of the skin, mucous membranes, and subcutaneous tissues. Although angioedema can occur in any part of the body, it is most often seen in the lips, face, tongue, larynx, and neck. Exposure to any ingested drug or chemical can cause the problem. The most common drugs associated with angioedema are angiotensin-converting enzyme inhibitors used for hypertension. The patient with angioedema presents with deep, firm swelling of the face, lips, and tongue. They may have difficulty speaking or drinking because the lips are so stiff from swelling. The face can be distorted that friends and relatives may not recognize the patient. Interventions for angioedema include oxygen by nasal cannula to help promote gas exchange. If laryngeal edema gets severe, intubation may be needed. Drugs that may be used for angioedema include corticosteroids, diphenhydramine, and epinephrine. Indications for intubation are the presence of stridor and the inability of the patient to swallow. Anaphylaxis is the most severe type of type 1 hypersensitivity reaction. It can occur rapidly and systemically. It affects many organs within seconds to minutes after the allergen exposure. Anaphylaxis episode can vary in severity and can be fatal. The major factor in fatal outcomes for anaphylaxis is a delay in the administration of epinephrine. Almost any substance can trigger an anaphylactic response. Drugs and dyes are often causes of anaphylaxis in the hospital setting. Food and insect stings or bites are common causes in community settings. Symptoms of an anaphylactic reaction can occur immediately. However, some may have a delayed response. Patients may have a feeling of doom or apprehension or something that's going to go wrong. Hives may be present as well as erythema and angioedema of the eyes, lips, or tongue. On auscultation, lungs may have crackles, wheezing, and reduced breath sounds. Patients may have a laryngeal edema and have a feeling of a lump in their throat. Patients may also experience hoarseness and stridor. Respiratory failure may follow from laryngeal edema, suffocation, or lower airway constriction causing hypoxia. The patient may also present as hypotensive with a rapid, weak, and irregular pulse. They may be faint or diaphoretic with increasing anxiety and confusion. Immediate intervention focuses on airway management. Emergency respiratory management is critical due to bronchoconstriction of the upper and lower airways. Establish or stabilize the airway. If an IV drug is suspected to be causing the anaphylaxis reaction, stop the drug immediately. Do not remove the IV venous access site, as it can be difficult to start a new IV on a hypotensive patient. Change the IV tubing and hang normal saline. Call the rapid response team. Ensure that intubation and trach kits are available. Apply oxygen using a high-flow, non-rebreather mask. Be prepared to administer epinephrine IV or IM. Keep the head of the bed elevated about 10 degrees if hypotension is present. If blood pressure is normal, elevate the head of the bed to 45 degrees to higher to improve ventilation. Raise the feet and legs. Stay with the patient and reassure the patient that the appropriate interventions are being placed. Epinephrine is given at 0.5 mL for the first dose. The same dose can be repeated every 5 to 15 minutes if needed. Antihistamines such as Benadryl can be given as a second-line drug. This can be given IV or IM. Patients who know that they have a severe reaction to any type of allergen must be prepared to use an epinephrine pen. This is a key nursing teaching point that must be delivered to patients to ensure for the proper use of an epinephrine pen. Have the patient practice assembly of an ejection device with the non-drug containing training device. Teach the patient to keep the device with them at all times. The epinephrine injection is injected into the top of the thigh, slightly to the outside, holding the device so that the needle enters straight down. You can inject the epinephrine injection through pants. Teach your patients immediately after the use of epinephrine to call 911. Teach the patients that they need to have at least 2 drug-filled injections on hand in case more than one dose is needed.